recall my first interview really well, actually. It was actually my first interview other than getting into medical school. So I'd um, probably practiced in an era where, as a junior doctor and as a trainee, I didn't really have to interview for roles. And so it was a big shock because it was the first time I had to undergo a interview process, and it was for a real job and it was for a non-clinical role. So I certainly did prepare quite a bit for it. I did that just by talking to some of my mentors and consultants that I worked with, and got them to sort of ask me questions and to prepare what my answers would be around that. I was in the fortunate situation of I was actually already in the role and had acted in the role previously, so that did give me a little bit of an advantage. And I'd been doing some of these non-clinical roles formally for a little while prior to that as well. So I had some experience with that, but the interview was still very nerve-wracking. There was a big panel, and they were people that I knew and obviously wanted to perform well in front of, regardless of whether I got the job or not. I certainly wanted them to think well of me. So that was quite nerve-wracking. I've done quite a few since then, and it does get better with time. So I do think it's a great opportunity to try and practice those interview skills whenever you can, actually. I think one of the other things that probably was a good preparation for me was, it was not long after my fellowship exams. So I'd been quite practiced in presenting for my fellowship exams, and had sort of all that knowledge to hand still, which was really helpful.